Good afternoon. We are approaching the Easter weekend, and under normal circumstances, this would be a time for fellowship and family with gatherings and celebrations across the province. But these are not normal circumstances. This is not the time to visit your families or attend church services, indoors or out. It is not the time for ATV rallies or river runs or other gatherings that traditionally take place on Easter weekend. It is the time to stay home, in your home, because staying home will save lives. Ce n'est pas le temps de visiter votre famille, ni d'assister à un service religieux, que ce soit à l'intérieur ou à l'extérieur. Ce n'est pas le temps de prendre part à un rallye de VTT, à une descente de rivière en canot ou à tout autre type de rassemblement de masse qui a habituellement lieu pendant la fin de semaine de Pâques. C'est le temps de demeurer chez nous, chez vous, dans votre propre maison. En effet, demeurer à la maison permettra de sauver des vies. This is hard advice to follow, and I do understand that. The temptation to gather with friends and loved ones will be great this weekend. Long-standing traditions have to be set aside. You may think it's just my family or it's just my friends, but the COVID-19 virus may be an uninvited guest at your table, brought along by someone who has only mild symptoms or no symptoms at all. Don't let that happen. Today, there are 3 new confirmed cases of COVID-19 in New Brunswick, and this brings our total to 108. The new cases are as follows. In Zone 3, the Fredericton region, 2 individuals aged 60 to 69. Zone 6, Acadie-Bathurst, 1 individual aged 80 to 89. We are continuing to take steps to manage the impact of COVID-19 pandemic. One important action being taken is to ensure we have a safe and reliable supply of pharmaceuticals for those who need them. I know there are many people out there doing essential work for New Brunswickers, and we truly appreciate your efforts. Vous pouvez penser que ce n'est pas grave parce qu'il s'agit de membres de votre famille ou de vos amis. Cependant, la COVID-19 pourrait se présenter à votre table, invité involontairement par quelqu'un qui ne présente pas de symptômes que de symptômes légers, voire aucun symptôme. Ne laissez pas cela se produire. Aujourd'hui, j'annonce qu'il y a 3 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick, portant le total à 108 cas dans la province. Les nouveaux cas sont répartis comme suit. Les nouveaux cas incluent des 2 personnes âgées entre 60 et 69 ans dans la zone 3, région de Fredericton, une personne âgée entre 80 et 89 ans dans la zone 6, la région d'Acadie-Bathurst. Nous continuons à prendre des mesures pour gérer les répercussions de la pandémie de COVID-19. L'une des importantes mesures prises consiste à nous assurer que nous avons à notre disposition une réserve fiable et sécuritaire de produits pharmaceutiques pour ceux qui en ont besoin. I want to take a moment to thank New Brunswick pharmacists, pharmacy technicians, and their staff who are working hard to ensure all New Brunswickers continue to have access to their medications during this challenging time. New Brunswick's 233 pharmacies remain open. Our community pharmacists are playing a major role in supporting our health system's response to the pandemic. At a time when in-person access to many healthcare providers is restricted, pharmacists are facing a surge in interactions with members of the public. They are helping to reduce non-essential physician visits by extending expired prescriptions, providing emergency prescriptions, assessing and treating more minor ailments. Please do your part to protect pharmacists and their staff by going to the pharmacy only when it is absolutely necessary. Please do not go to the pharmacy if you think you have COVID-19 or you think that you might have it, or you think you have come into contact with someone who has it. Call your pharmacist to ask questions instead or arrange for curbside pickup or delivery of your medications. Veuillez contribuer à protéger nos pharmaciens et les membres de leur personnel en vous rendant à la pharmacie seulement quand il est absolument nécessaire de le faire. Ne vous rendez pas à la pharmacie si vous êtes infecté de la COVID-19 ou croyez que vous pourriez l'avoir contracté. Appelez plutôt votre pharmacien pour lui poser des questions ou obtenez vos médicaments par l'intermédiaire d'un service de cueillette sur place ou livraison. It appears that we are continuing to do better than many jurisdictions in terms of case numbers, hospitalizations, and severe illness. Whether this continues is up to you. It would be tragic to see an upsurge of cases after this weekend because people decided to have family gatherings over Easter against the advice of this office. There are other ways to celebrate the season. Family gatherings can take place virtually, with everyone safe in their own homes. Religious services can be live streamed, but no congregation members can be on site, and those operating video equipment must maintain physical distancing. With your cooperation, we will make Easter and all religious observations as safe as possible for everyone. Mass recreational events, big gatherings, will have to wait for another time when they can be conducted safely. Les cérémonies religieuses peuvent être diffusées en direct, mais aucun membre de la congrégation ne doit se trouver sur place et les personnes chargées de faire fonctionner la vidéo doivent respecter les règles de distanciation physique. Grâce à votre collaboration, nous rendrons cette fête de Pâques et toutes les cérémonies religieuses aussi sûres que possible pour toutes et tous. Les activités récréatives de groupe devront attendre à plus tard, lorsque sera possible de les faire en toute sécurité. You can also use this weekend to give thought to how you can show compassion for your fellow New Brunswickers. The Premier and I speak every day about case numbers and percentages, but we must remember these are people. They are men and women and children with lives and hopes and families. They need and deserve our compassion, especially now. Your neighbor may have COVID-19, or they may be concerned that they have come into contact with it, or they may be concerned about a loved one. They may be self-isolating to prevent the further spread of this disease. No one needs or deserves your fear, your contempt, or your condemnation. They need and deserve your compassion. Your neighbor, again, anybody who's concerned that they may have come into contact, whether they're in your community or not, I think we do have to be very, very aware of stigma, ostracization, and harassment. We really don't want to see any of those actions taking place. Votre voisin pourrait être infecté de la COVID-19 ou craindre d'avoir été en contact avec une personne qui l'a contracté. Votre voisin pourrait être en train de s'auto-isoler pour prévenir la propagation de cette maladie. Votre voisin ne mérite pas vos craintes, votre mépris, ni votre condamnation, et n'en a pas besoin non plus. Votre voisin mérite votre compassion et en a besoin présentement. This is a difficult time for anybody who is touched by COVID-19. The grieving process will be very difficult, as this isn't a time that we can have funerals that are in a normal way. This is not a time when we can actually visit loved ones in the hospital who have COVID-19. This is very, very emotionally challenging, and I think we have to respect that for everyone. So give your neighbor a call this weekend just to chat, or one of your loved ones that you know is isolated. Offer to pick up groceries, medications, or other needed supplies. Show them that you care and that you want them to regain their health as soon as possible, and tell them they are not alone. In particular, I would ask that this weekend you give thought to the plight of your elderly neighbors. It is a stressful time for many of them. They are separated from their families and struggling to maintain their independence. And while anyone of any age can contract COVID-19, it is among the elderly and those with underlying health conditions that this can be most severe. And I'm just going to quote some words from the American songwriter John Prine, who has toured here in New Brunswick, and I have many musician friends in town, and obviously there are many music fans in town in Fredericton and around the province who were fans of John Prine. And sadly, Mr. Prine died yesterday in New York of complications related to COVID-19. And he has a song called Hello in There. And he wrote of an elderly couple struggling with the isolation of old age. And he wrote, "You know that old trees just go stronger, and old rivers get wider every day, but old people just grow lonesome, waiting for someone to say hello in there." This weekend, be that someone. Pick up the phone and say hello in there to a neighbor in need, or drop off something on their doorstep. Show compassion to your fellow New Brunswickers in this stressful time. I promise you, you will be glad you did. En fin de semaine, soyez cette personne. Dites bonjour et saluez un voisin dans le besoin. Faites preuve de compassion à l'égard de vos citoyens du Nouveau-Brunswick en ces cas difficiles et stressants. Je vous garantis que vous serez heureux de l'avoir fait. Merci beaucoup.
Good afternoon. Bonjour. For many New Brunswickers, the Easter long weekend is traditionally a time to get together with family and friends. We attend church services, have big dinners, we visit, we go on an Easter egg hunt. This year must be different. Lorsque vous quittez la maison pour acheter des produits comme l'épicerie, rappelez-vous de choisir une seule personne de votre maison qui sera le commandateur désigné lorsque c'est possible. I understand that for some, it isn't always possible to leave your children at home. If you see someone shopping with a child, please be kind and remember that you don't always know the situation another person is experiencing. The majority of people are doing their best and doing the very best they can during this challenging time. It is very important, however, that we obey the directives set out by public health. The impact if people don't obey the rules, if people don't stay home and maintain physical distancing, this could be catastrophic. Certains d'entre vous pensent peut-être que nous sommes trop prudents, que nous exagérons le danger. Vous pouvez voir les chiffres chaque jour, et si on se compare à d'autres endroits, le Nouveau-Brunswick se porte bien jusqu'à présent. Our numbers may not feel like they've increased that quickly. You might think that we have this handled, but now is not the time for complacency. We cannot be complacent. We must stay strong, stay focused, and stay home. Pour que les choses reviennent à la normale le plus rapidement possible, il est plus important que jamais de respecter la loi. The more people go out, visit friends, drop by to see family, the longer this will drag on for all of us. It is important to remember that while we are talking about numbers, those 108 cases identified thus far are people with friends and loved ones of their own. Certaines de ces personnes sont à l'hôpital, certaines en peur. Leurs amis et leurs familles ne peuvent pas les aider. When you have COVID-19, no matter how sick or scared you are, you must be isolated for the safety of others. No one wants that for someone that they love. That is why this weekend I won't be having Easter dinner and visiting my mother. It is why I won't be enjoying an Easter egg hunt with my grandchildren. And I won't be the only one making these sacrifices. Nos travailleurs de la santé seront très occupés pendant la fin de semaine. Mais ils ne passeront pas de temps avec leur famille et leurs amis, comme ils leur voilà. Ils vont plutôt fournir le part des efforts pour assurer la sécurité des gens de Nouveau-Brunswick. Our law enforcement officials will be also out and about this long weekend, doing their part to keep New Brunswickers safe. Their goal continues to be to educate and advise about what must be done to flatten the curve and slow the spread of COVID-19. Ideally, no one will be ticketed. Ideally, everyone will be following the rules. Si vous ne respectez pas la loi, si vous avez été averti et que vous continuez à ne pas respecter les règles et à mettre la vie de tout le monde en danger, il y aura des penalties. If you make the decision to not obey the rules, there will be a cost. As we head into the long weekend, stay home and stay safe. Do this not just for yourselves, but for your family, your friends, and all New Brunswickers. If you do venture outside, ensure you are respecting the rules in regards to social distancing. Every person in this province has the power to make a difference. And all you need to do to make that difference is to follow the rules from public health. I understand it is difficult, especially as the weather gets better and this situation continues. If we follow the rules this weekend and stay home, we will possibly be able to enjoy the really good weather when it finally arrives. We live in a beautiful province, and under normal circumstances, we like to get out and explore. We know there are at least 2 ATV rallies planned this weekend. That is a mistake. A rally exposes you to friends and neighbors unnecessarily. These are not normal circumstances. Please help us to control these symptoms, to control this disease, and to have it subside. Please don't travel any further than you must. To date, we have 108 cases identified positive out of 6,600 tests. Of the 108, 50 have recovered. While this is good news and shows we are gradually improving, that could all be lost this weekend. At a funeral in Newfoundland, one case became 17 and then grew to 143 cases, all from one person with no evident symptoms. Plus vous allez loin de votre maison, plus vous pouvez être en contact avec des personnes, et plus grand est le risque pour vous et les autres. Une fois que cette pandémie sera terminée, notre belle province sera toujours là, prête à être explorée. And one day it will be over. Every day that passes, we are one day closer to that moment. But before we reach that point, we know there will be some tough days ahead. More New Brunswickers will get sick. Some may not survive. None of us want to see this happen. This long weekend, you must do your part. This long weekend could be a turning point for New Brunswick. This long weekend could be the one where we say New Brunswickers are on the roadmap to recovery and that we can once again look forward to a summer COVID-free. Is it possible? Let's not make this weekend determine the otherwise. Let us move and continue to move in a direction of being safe, healthy, confident, capable, and looking after our neighbors and not taking unnecessary chances. Stay healthy and stay home. Thank you. Merci.
Thank you, Premier. Merci, Monsieur le Premier Ministre. Merci, Dr. Russell. Thank you, Dr. Russell. We will now proceed with questions from the media. Each reporter will have one question. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question. Andrew Waugh, Telegraph Journal.
Hello, my question is to the Premier. Premier, you mentioned two ATV rallies this weekend. Where are they, and do you plan to shut them down?
Well, there's in two separate parts of the province. I won't identify particularly because these are the only two that I was made aware about. But I think that a lot of people, when the weather's good, now it's supposed to snow on Thursday and Friday and be miserable, so that's good. Maybe that'll extend on into Saturday and Sunday and Monday. But in case it doesn't, and the weather, which is currently predicting to be good, I'm just saying it's a common sense approach. It applies all across this province. And people just need to say, look, you know, the weather's going to be a lot better in a month or two from now. I'd really like to be able to enjoy that. So let's not lose it on the first long weekend in the spring. And cause our current trends to reverse, because we want to see our current trends continue to get better.
Andrew, do you have a quick follow-up?
Yes, I do, and again, it's to the Premier. Thanks, Bruce. Ontario Premier Doug Ford has just held his daily press conference, and he said he's run out of patience with the testing not being done to the province's capacity. They can do 13,000 tests a day, so he wants 13,000 tests a day done. Obviously, New Brunswick, you said, has a capacity of 1,000, but we're not getting to 1,000. Are you going to get to the point where you demand this gets ramped up to 1,000?
Well, I will start that question or answer, Andrew, but I think maybe Dr. Russell would like to speak to it as well. You know, I appreciate that Ontario is in a different situation than we are here. Given the standards that we have put in place by the public health, we've followed those very closely. I think they've been explained numerous times. But the point of the situation is that, and I've said this too many times, we have enacted restrictions and put in place the protocols necessary to protect our citizens and to protect this virus from spreading And if people follow those protocols, it won't matter how many people we test, because it won't change what we're doing in terms of how we have laid out a way to protect citizens. What will cause us to be into a situation like maybe we're seeing elsewhere is if people don't pay any attention to the rules, and they congregate and they put unnecessary exposure to themselves and to their family. Right now, knowing what we know and seeing what we're doing, and with the changes that have been made, the public health continue to evolve and allow our testing to be done where they feel it is most necessary to do so. We have the capability to ramp it up if need be, and we will. But we'll continue to follow the rules that are laid out by public health, because thus far, and with the rules we put in place physically, it would appear to be working. But I gave an example of where it could all go sideways. And the last thing that people cannot do is think, oh, this is over, or become complacent, because it just takes one or two people that are positive to infect an entire community and in one single event. And that could be an ATV rally way out in the middle of the woods with 30 of your friends, that they go and visit their family and so on and so on. And out in the middle of the woods, you're thinking, how nice is it here in New Brunswick? We don't have to worry about this out here. Well, yes, we do right now.
Thank you, Andrew. Elizabeth Fraser, CBC.
Hello, my question is for Dr. Russell. Evidence suggests COVID-19 in children may cause a very mild response, maybe even look like the common cold. At this stage in the COVID response, what symptoms in teens or children would indicate a need for COVID testing? And also, what is your message for adolescents who can't seem to resist meeting up with their friends?
So that's two questions. So the first question is around testing. The information that we've provided to the 811 staff, they are able to take questions around symptoms. That's true. And if they feel that there's a need or a concern based on the answers provided and based on the risks that they perceive, then they would recommend testing. Just like the beginning of the outset, I've said several times, the family doctors who are working virtually can also provide some guidance and offer appointments. So I urge people to also go through that route if needed. And yes, we are seeing milder symptoms in younger people, but that doesn't mean that it's zero in terms of the cases that have occurred in other jurisdictions. For adolescents, we are saying that we don't want to see anybody visit with people outside their own homes. So that is the advice that for whatever age you are. So whether you're a teenager or not, we are recommending that you do not socialize with people outside your home.
Elizabeth, do you have a quick follow-up?
Yes, I do. It's for Dr. Russell. Shannocks will soon be requiring employees to wear non-medical masks at work, except in situations where it's necessary to wear N94 masks. Do you think this is necessary for those employees to wear non-medical masks at all times? And if so, why aren't employees in hospitals or other long-term facilities doing this?
Well, the research recently has just changed with respect to what we've gotten from Public Health Agency of Canada. So I do have some communications in the works for healthcare facilities and nursing homes, et cetera. So the information that we have now is around asymptomatic or pre-symptomatic transmission, and it's about protecting others from becoming infected with you. So there'll be more information coming out around that, but as of right now, that's the basis of the recommendations.
Thank you, Elizabeth. Michel Corriveau, Radio-Canada.
Bonjour, c'est une question pour le Premier ministre au sujet des pêches. Est-ce que la province pourrait avoir un fonds d'urgence pour les entreprises dans le secteur des pêches au mort et au crabe si jamais il y avait des pertes ou si la saison était annulée?
Yes, I think that's possible. I think that right now we're working with the federal government, and because DFO have to make the decision whether they will allow the fishing season to continue or not. And we're working with them to see what that looks like. I know in different parts of the province or in our Atlantic region, it means different things to different people in terms of lobster fishing and in some cases, export of live lobster versus New Brunswick, which is a processor. So obviously, if DFO makes a decision that negative reflects our situation here, we'll be looking for compensation for the fishers for that industry.
Merci. As-tu un suivi, M. Corriveau?
Oui, M. McFarlane. C'est pour M. Higgs toujours. Alors, si les usines n'engagent pas tous les travailleurs habituels, là, je parle des usines de poissons, de transformation de fruits de mer, donc, et si les usines ferment carrément, est-ce qu'il y aura de l'aide pour les travailleuses et les travailleurs d'usines?
I think the same kind of the same logic would apply if these facilities aren't able to open up as they normally would. Then we'd have to look at what that means to the workers that would normally be covered, and also how that would reflect of a decision made totally for the COVID reasons, and that was the very basis on which funding was being applied to various individuals or companies around the province. So that logic would apply. I would say that right now there is a debate going on about temporary foreign workers, and I'm thinking that we probably have an opportunity in New Brunswick to look at maybe some of those businesses that were traditionally filled with temporary foreign workers, and they won't be available. As we look to restart our economy, we'll have to think of innovative ways to get our economy up and running in all sectors. But it's finding workers to be available to do that is going to be a critical component.
Thank you. Merci, Michel. Vicky Hogarth, Charlotte County TV.
Thanks, Bruce. My first question is for Dr. Russell. First community transmission COVID-19 patient in New Brunswick is now speaking out about her experiences. She claims to have been self-isolating, practicing good hygiene, and only going out to walk her dog when she caught the virus. And obviously we know that non-porous surfaces such as countertops and doorknobs transmit the virus better. But is it possible for porous materials like pet fur to transmit COVID-19, say if a person pets your dog while you're on a walk?
So earlier in the pandemic, we did have some information around how pets can be involved or not involved in transmission of COVID-19, and the research was definitely not definitive. So our advice was if you were self-isolating, that perhaps you should not self-isolate with your pet, but we do recognize that pets are members of your family, and so they provide emotional support, etc. So in this particular case, we don't have all the evidence around whether or not pets are transmitting or not, or whether they're vectors at this point. And so I think all I would say is make sure you practice really good hand hygiene, and I think you should really not let other people touch your pet, and when you're out in public, when you're walking your pet. And so that's my best advice around pets right now.
Thank you. Vicky, do you have a follow-up?
Yes, thank you. It's for the Premier. Premier Higgs, approximately how many Canadian nurses from New Brunswick work across the border in Maine? And have you spoken to Senator Collins recently? Do you know if she's reminded President Trump of our intertwined relationship, Maine and New Brunswick, and how their hospitals rely on Canadian nurses?
Well, we certainly did indicate that in relation to the discussion we were having around Campbell Island and people's need to cross back and forth across the border, and that applied to all professions. I don't know exactly how many that actually have, work in the hospital, whether it be in Lubeck or vice versa, working in the St. Stephen Hospital. I can find out or ask for that information. As for speaking with Senator Collins, I have not spoken directly with Senator Collins. There would be people that within our departments that will have likely spoken to individuals there, because we are in contact with Maine officials about their situation, and also understanding their supplies. Most recently, we were asking about their supply situation and what they were in need of, and going back and forth. Because we are working together, not only with our own Canadian counterparts, but also our immediate neighbors. And despite what we recently would have seen, from the U.S. official position from President Trump, We basically feel it's important that we look after our neighbors around us, because at the end of the day, we each rely on each other.
Thank you, Vicky. Mike Cameron, CTV.
Thank you, Bruce. Asking a question of Dr. Russell on behalf of a person who contacted us. They were wondering if testing for COVID-19 would be expanded to include any workers or residents of a senior's residence or nursing home where a case has been identified. They were thinking of the Shanex case in Quispam-Cis, but the same question would apply to any senior's residence or nursing home in the future, I guess. I mean, will residents in those cases and workers in those cases be tested?
So each situation is assessed by my regional team based on the risk, based on exposure, et cetera. So those types of questions can't be answered in a broad way in terms of, each nursing home will be treated the same way. It'll always depend on the type of exposure and doing the contact tracing that would normally be done in that type of setting. So the testing would be based on the risk assessment that the regional team would do, and the appropriate people who need to be tested will be tested.
Mike, do you have a follow-up?
Yeah, for Dr. Russell again, if you don't mind. The doctor alluded to what looks like better numbers here in New Brunswick compared to other jurisdictions in terms of the number of cases that have been confirmed. For example, we are less than a third the number of cases of our neighboring jurisdiction in Nova Scotia. And I wonder if the doctor has come to any conclusion, or if she's investigating why that would be. Is it because of the numbers we're testing, or who we're testing, or how could that be? I mean, if Dr. Russell has come to any conclusions?
I think it's very early in the pandemic to really come to conclusions, because again, we're continuing to monitor the numbers in terms of, things that we're looking at right now are based on whatever people's actions and activities were 2 weeks ago, really. So the picture that you get today is basically things that happened almost 2 weeks ago. So moving forward, that's really the snapshot in time that we have. With respect to testing, we have continually changed our case definition as the national case definition changed, which changes who we test in terms of prioritization. So we have expanded changed the case definition. We've expanded the testing criteria to no longer include the criteria of having traveled outside the province. So we are testing symptomatic people who have not traveled at this point in time. We are prioritizing healthcare workers and people in vulnerable situations and institutions. And we have, for a couple of weeks now, been doing what's called sentinel testing, where we were testing people in the hospital and in emergency departments who were not considered, who hadn't traveled either. And so this has been going on for several weeks, and none of those test results came back positive. So these are good indications that we are on the right track at the moment, but that doesn't mean that we'll stay on the right track. Obviously, the other indicators that we're looking at would be hospitalizations and ICU admissions, because we know that those are a reflection of the total population in terms of how many people have been infected. So as you see the number of cases go up in total, you will see a proportionate increase in the number of hospitalizations and a proportionate increase in the number of ICU admissions based on the hospitalizations. So there's the total number, and then the percentage that's hospitalized, and of the hospitalizations, the people who are in ICU, et cetera. So those are some of the indicators that we're looking at. And again, we're going to continue to do the testing based on the case definition and the criteria that we have right now. As the Premier said, we have the capacity to test up to 1,000 people a day. We have all of our testing centers up and running. We have access to 811. We have access to virtual care with family physicians. So I think that this will continue to evolve. We will continue to monitor and see what happens based on, again, the advice and the measures that are in place right now with respect to social distancing and no mass gatherings, et cetera, and only essential businesses are open. So all of these measures combined with the testing, with the advice, and with people following those recommendations and following the emergency measures that we have in place, I think all of this will continue to generate information. I did see somebody post something somewhere that they thought that we had peaked already here in New Brunswick, and I can't imagine that we have already. Again, we are going to keep our eyes open, continue to monitor, continue to look at the data, and continue to encourage everybody in New Brunswick to follow our recommendations.
Thank you, Mike. Silas Brown, Global.
Hi, Premier. We've heard from people in the Moncton area who are being pulled over by the RCMP and questioned about where they are going. The Kodiak RCMP is also telling the public that people can be pulled over and be fined if their travel is deemed to be non-essential. I have not been able to find anything myself in the state of emergency declaration that mentions anything about limiting travel within the province. So I'm curious, where this power is coming from, if it's coming from the state of emergency, and if not, why are police being allowed to conduct what effectively amounts to street checks?
I guess, we are in unusual times right now without question. And although the directive is not to say, you can't go from point A to point B within our province, the directive is we encourage people to stay home and use their common sense and go for essential travel only. So to understand, and I personally, I commend the initiative of the police force or public safety to understand where people are going and why, because that helps us make better decisions on what's required to limit exposure. So if they find out, and I think there've been cases where people have crossed crossed through communities, and I think crossed some of our borders, or tried to initially, maybe just for a coffee, and that's not an essential service. Maybe some think it is, but basically right now it's not. And I think so. For me, I'm saying the more understanding we have of where people are going, because we're getting a lot of questions from different communities to say, we don't want these people in our community. Well, I don't want to start putting borders up around communities, and right now we don't have a need to do that. But if people don't use their judgment and they're going into a community unnecessarily because they don't live there, and yet they're exposing people there, or they could themselves be exposed, why would you do that? Why would you put yourself at risk, or why would you put others at risk at a time like this? So the more information the safety officers can glean from stopping people, I'm not going to complain about it. I'll just look forward to hearing more about what's happening, and do we need to do more to prevent it.
Thank you. Silas, do you have a follow-up?
Yeah, can you be extremely clear with New Brunswickers here and tell them, what exactly they can do? If somebody, for example, this weekend feels like going for a drive, not necessarily even leaving their car, can they expect to be pulled over and fined by provincial police for doing that?
I don't think they will be fined. They could be pulled over and asked. Now, they might be fined if they're speeding or doing something other than that. But if it's a car full of people going somewhere, well, right there's a violation, because we're saying and they're not family members. So let's say you saw a group of people traveling, and they're questioning, are these family members or are they not? Now, I would say then that's reason to pull someone over and find out what's the situation, because that would not be practicing our social distancing requirement. If someone, through the process says, they drive around their community, they don't get out of the car, they're family, they're not friends and neighbors just traveling. Are we going to fine them for that? No, we're not going to fine them for that. But there is a common sense element here. That's what we're asking people to pay attention to. Don't take anything for granted. Don't take any unnecessary chances, because you're only exposing yourself and other ones and other loved ones that you could hurt inadvertently. Think about that, the example I used of the funeral home in Newfoundland, where one person went to 17 and went to around 150. And that's what it takes. It's just somebody who says, this isn't my problem. Well, it is. Every one of us has a duty here. Every one of us has an obligation. And I'm convinced that we can lead the country here in minimizing our exposure by doing what makes sense.
Thank you, Silas. Kevin Bissett, Canadian Press.
Question for the Premier. Premier, I want to follow up on a question from Michelle Corvo earlier. While it is a federal decision, what advice are you giving Ottawa in regards to the opening of the spring fishing season in the province, and what impact could that have?
Well, at this point, we would like to see it delayed. But that'll depend, we're working with our other provinces and what it means to others as well. But I think if we had a choice, it would be delayed at least for a few weeks and maybe a little longer. But we are, having these discussions with our officials and other provincial officials to determine what is the best outcome.
Kevin, do you have a follow-up?
Yeah, just quickly, if the season were canceled or at least reduced, who should be providing compensation? Should that be the province or Ottawa?
It's a federal decision. DFO manages these resources, and if it comes to a point where the season is canceled, I mean, that is another whole new story. If it comes to a point where there's delayed, it can be recovered, but in either case, we would expect the federal government to compensate.
Thank you, Kevin.
Thank you.
Thank you. Mathieu Wakomo, l'Acadie Nouvelle.
Bonjour, je ne suis pas certain si ma question est pour Dr. Russell ou le Premier ministre. Je me demandais si la province avait toujours l'intention de publier ses projections concernant le nombre de cas et le pic éventuel, et si oui, à quel moment ce serait rendu public.
Peux-tu le répéter une autre fois, s'il vous plaît?
Oui, j'aimerais savoir si la province a toujours l'intention de publier ses projections du nombre de cas et le pic éventuel, et si oui, quand ce sera publié, quand ce sera rendu public. On sait que le Québec et l'Ontario, l'Alberta ont déjà rendu ça public, notamment.
Yes, we will be publishing our information. In fact, we're reviewing with Public Health and with the Health Department and our new pandemic task force today. We hope we will be meeting as a COVID committee later today and Cabinet tomorrow. At this point in time, we could be ready to publish it tomorrow, but if not, it could be some early next week. But we're not talking weeks here, we're talking days. But when we publish it, it'll be information that is worthy of publishing. It'll be, estimates of like we have seen in other provinces of worst case, best case scenarios, and make it as relevant as we can, which is difficult in terms of the testing process and the number of cases that we actually have at this point, to determine, can we make an accurate projection at this stage? And that's been kind of the focus here, is how accurate can we be? We want to make sure people realize this is very, very real. The potential is very, very high. And so the situation that we present wants to be as accurate as possible, needs to be as accurate as possible.
As-tu un suivi, M. Como?
Oui. Thank you, Premier. Dr. Russell, êtes-vous d'accord avec la publication de ces projections-là, et pensez-vous que c'est une bonne idée, et pourquoi?
Oui, je crois que c'est une bonne idée parce que ça nous donne des projections pour qu'on puisse vraiment faire des ajustements comme nécessaire pour la planification. Alors, les plans qui sont déjà mis à jour, qui sont déjà mis en place, s'il faut les ajuster, il faut vraiment avoir un plan qui inclut tous les détails, tous les scénarios, parce que si on planifie pour seulement quelque chose qu'on croit qu'il va arriver, puis on planifie pas pour le cas le plus pire, ça veut dire qu'il y aurait des surprises au niveau de planification, puis on ne sera pas préparé. Alors, c'est vraiment pour donner l'information au public, et c'est aussi pour informer la planification.
Merci. Merci, M. Como. Danielle McCready, CBC.
Hi there, my question is for the Premier. Public Safety Canada recently compiled a list of essential services as a guide for provinces to follow, but each province can kind of change that list as they deem necessary. In New Brunswick specifically, who compiles the list of essential services, and are we following the Public Safety Canada list?
So I can't give maybe an accurate statement on the current list and how we're following that, but certainly the list that we are following today was a combination effort from Public Health, from our Health Department, from our Public Safety Office. So it was a combined effort looking at actions taken around the world and in other jurisdictions, and basically following a protocol of what could have the greatest impact to reduce spread and to reduce kind of a combination of reducing impact while at the same time ensuring that we could maintain both a financial capability, a health capability, and a resemblance of daily activity that people could live with.
Do you have a follow-up, Danielle?
Yeah, I've got a question for Russell.
Doctor?
There has been an issue of false negative tests in COVID-19 in Ontario. Has there been an issue of any false negative tests in here in New Brunswick? If so, how do you go about fixing those problems?
I haven't been made aware of any false negative tests at this time.
Thank you. Pascal Archnug, l'Acadie Nouvelle.
Oui, bonjour. Ma question est pour le Premier ministre. Premier Higgs, I'm digging into how emergency measures compare in the Atlantic provinces, provincial measures. Nova Scotia has decided to offer targeted grants to affected businesses. I'm wondering, are you considering offering such grants in New Brunswick or perhaps other additional measures to what's being offered now?
We are considering, Pascal, all aspects of the economic recovery model. So I believe with ONB and our Navigator program, we've had now over 1,200 businesses that have connected and seeking direction through the federal program, as well as what could possibly be available provincially. We've said all along that our goal was to connect and fill the gap there. We're also looking strategically all over our province and saying, how do we get communities started back up? How do we get businesses started back up? How do we get lives back to normal? So even though our focus continues to be on health, we are also including in our focus now a recovery aspect of how do we get New Brunswick back. So yes, we don't exclude or any possibility that we will have to participate in a financial way provincially as well. And we had announced some programs to that effect. I spoke yesterday a little bit of individual programs as well as business-related programs that had a range. I think the business side was varied up to $1 million, I think, but it'll vary depending on the situation.
Thank you. Monsieur Nog, as-tu un suivi?
Wait, my question now is about more individuals. Nova Scotia has increased payments to social assistance recipients by $50 per person. Have you thought about doing the same in New Brunswick?
So not directly. I'm sure social development are considering the aspects and the impacts on social assistance recipients so that we can certainly maintain them whole as well as we're looking with everyone else. So I haven't had that particular aspect brought forward at this stage, but I know we have looked at all cases of impact, the concerns on social assistance, the concern of mental health, the concerns of access. I have information, different stories that we're saying that people that need support need it now. We've been in touch with companies that want to support and be helpful in this process. So it is on the radar. I just am not aware of a particular initiative like you've described in Nova Scotia at this point.
Merci, Monsieur Rachenot.
Merci.